Welcome back to Great Day Washington. You know, it's part of our culture today. People like to be tan. They like to relax in the sun. But of course, those rays are very harmful and it comes with a lot of risk. May is National Skin Cancer Detection and Prevention Month. And this morning we're catching up with Dr. Shah from Capital Laser and Skincare. Welcome again. Thanks for coming on in.
Thanks for having me.
Okay, so we hear it all the time. Stay out of the sun. It's almost like obviously now we think this is not what we should be doing, but I don't think we're all taking it seriously, me included. So, why is it so important? Why do we need to pay attention to these signs?
Well, I think the important thing about skin cancer is two things. One is it's preventable. So we know there are certain risk factors that will increase your risk of melanoma, or sorry, skin cancer in general. So that's excessive sun exposure and tanning beds. So prevention in the sense of wearing sunscreen, wearing hats, wearing your sunglasses, staying in the shade, avoiding the midday sun exposure, avoiding tanning beds. And then the second thing is detection. So coming in for skin checks, we can check your skin and evaluate anything that's concerning, or just do our baseline checks or regular checks to see if we find anything that would need to be taken care of.
And there's sort of a 5-step process. We have kind of a visual of that so that people can kind of see for themselves, like, is this what my mole is looking like? But then they can also come see an expert, of course, to kind of walk through that.
Exactly. So these are the ABCDs of melanoma. So this is specifically for melanoma. The A stands for asymmetry. So if you break the lesion in half, one half is not symmetric to the other side. B is border irregularity, if you see the scalloped irregular borders. C is color variation, so if part of the spot is dark and part of it's light colored and part of it's another color, then that's a concerning sign. Diameter is the size of the spot, if it's bigger than 6 millimeters, although skin cancers can also be smaller than that. But one thing that's not on this diagram is the E that has recently been added, and that is evolving. So anything that you notice that is changing, something that's been there for, you think forever, but it's changing, that definitely needs to be evaluated.
And you have machines at your office too to be able to kind of scan that and see those UV rays exposure over years.
Right. We have something called the VISIA complexion analysis, which can analyze your UV exposure, can show you some sun damage on your skin. It does not detect skin cancer, but it is a good way to know if you've had a lot of damage. So
yeah, it's shocking.
Really surprising what you see under those lights.
Definitely. Now, of course, we want to be able to check our own skins, but sometimes, the back, we can't see things, so it's super important to come in.
Right.
You see patients of all ages, and, again, last year in the New York Times, there was this woman in her young 20s. She had skin cancer, but didn't know it.
Right.
We think we're invincible in those ages, and, it was kind of horrifying to see these photos, the fact that she was so young. And I think that a lot of people can relate to that, but at the same time, why didn't we stop doing it at those ages?
Right, right. It is not uncommon to hear these stories. In fact, the associate physician in our practice is also a similar story. Someone who's had a lot of sun exposure, fair complected, tanning beds in her youth, developed a melanoma in her 40s, 2 of them, and a basal cell carcinoma. So
she developed in her later 40s.
Correct.
But did all that damage in her 20s and kind of took a break, so to speak?
Exactly. So a lot of the damage is accumulated in the youth when we don't know any better, and then shows up later in our skin.
So all the more reason why I need to get into a doctor's office to check my moles, or just pay heed to my skin more so.
Right.
On my back, I need a mirror.
Right, right. Well, you also can have a partner looking at your back. That's very helpful.
A mirror.
Right. A mirror is also good. But we definitely advocate doing self-skin exams at home. You can always Google self-skin exam. It'll show you how to do that. You want to look at all areas of your body. Skin cancer can affect even non-sun exposed areas. But more importantly, if you're high risk or if you have anything concerning, come into the office.
And I'm high risk now because of that. It's so fascinating. Then they come into your office, sometimes maybe just at that nick of time. But you said that they're kind of better patients than us.
Well, oftentimes it takes a little bit of a push to get them into the office, but they're an extremely important category that we need to discuss. So men over the age of 50, Caucasian men over the age of 50 are have the highest incidence of melanoma. So getting them in the door is the key, because once they're in the door and we find a skin cancer, they're very regular about coming back. But Women, definitely encourage your spouses or significant others to come in to have spots checked or skin checks in general.
Okay, something else that I thought was interesting. You said that somebody who was the sunbather down in Florida for X number of months a year,
right.
She came in and you found some skin cancer. It's kind of like, yeah, well, that makes sense. But it was in a place where the sun doesn't even get to it.
Right.
So, kind of. So that could be with anybody then.
That could be with anyone, and definitely that's why it's important to do the self-checks at home. But again, it's also important to realize that skin cancer does not always affect sun-exposed areas.
Yeah.
That's why we take a look at the whole skin. So because you've had a lot of sun exposure doesn't mean you're going to get a skin cancer on a sun-exposed area. You can get it even on a non-sun exposed area. And it's also important to know that all ethnicities, all skin types, all skin colors can get skin cancer. So if you see something concerning, don't blow it off. Definitely come in and have it checked.
And if you did the damage maybe when you were younger, make sure you get into a doctor's office to check those moles. I'm sorry, Mom, I never listened to you. It's like one of those things. Thank you again, Doctor, for coming in. Like I said, I'm so passionate about understanding this a little bit more. And, you and I will have to keep chatting a little bit, too.
Right, definitely.
All right. Well, we're going to send it back into the studio and see what Chris and Marquette are up to. Guys?